Clavicle. Latin, it means a small key. It is a long bone, which means it has a two ends and a curved part called as a shaft. This supports the shoulder so that the arms can swing clearly away from the trunk. The clavicle transmits the weights of the upper limb to the sternum. Side determination. The lateral end is flat, medial end is large and quadrilateral. The shaft is slightly curved so that the convex forwards in its medial 2/3, concave forwards in its lateral 1/3. Inferior surface is grooved longitudinally in its medial 1/3. Peculiarities of clavicle. It is the only long bone which lies horizontally. It is subcutaneous throughout. It is the first bone to start ossifying. It is the only bone which ossifies in the membrane. The only long bone which has the two primary centers, and there is no medullary cavity. It is ossically pierced by the middle supraclavicular nerve. It receives the weight of the upper limb via the lateral 1/3 through the coracoclavicular ligament and transmits to the axial skeleton via the medial 2/3 part. The features of the clavicle. Shaft. Shaft is divisible into the lateral 1/3 and the medial 2/3. Lateral 1/3 is flattened from above downwards. It has two borders, anterior and posterior. Anterior is concave forward and posterior is convex backward. It has two surfaces, superior and inferior. Superior is subcutaneous. Inferior presents the elevation called as an conoid tubercle. Conoid in the Greek means cone, and a ridge called trapezoid ridge. Medial 2/3 is rounded and is said to have the four surfaces: anterior surface, posterior surface, superior surface, and inferior surface. Anterior surface is convex forwards, posterior surface is smooth, superior surface is the rough and medial part. Inferior surface has the rough oval impression at the medial end. Lateral half of this surface has the longitudinal subclavian groove. The nutrient foramen lies at the lateral end of the groove. Lateral and medial ends. Lateral or the acromial end, acromial in the Greek means the peak of the shoulder, is flattened from above downwards. It bears the facet that articulates with the acromion process of the scapula to form the acromioclavicular joint. Medial or the sternal end, quadrangular and articulates with the clavicular notch of manubrium sterni to form the sternoclavicular joint. Articular surface extends inferior aspect for articulation with the first costal cartilage. Attachments. At the lateral end, margin of the articular surface for its acromioclavicular joint gives attachment to the joint capsule. At the medial end, margin of the articular surface for the sternum gives attachment to the fibrous capsule, articular disc, and interclavicular ligament. Fibrous capsule of the sternoclavicular joint all around, articular disc posterior-superiorly, and interclavicular ligament superiorly. Lateral 1/3 of the shaft, anterior border, posterior border, conoid tubercle and trapezoid ridge. Anterior border gives origin to deltoid muscle. Posterior border provides insertion to the trapezius muscle. Conocoid tubercle and trapezoid ridge gives attachment to the conocoid and trapezoid part of the coracoclavicular ligament. Medial 2/3 of the shaft, anterior surface, posterior surface, superior surface, inferior surface, and subclavian groove. Most of the anterior surface gives origin to the pectoralis major. The posterior surface close to the medial end gives origin to the sternohyoid muscle. Half of the rough superior surface gives origin to the clavicular head of the sternoclavicular joint. The oval impression on the inferior surface at the medial end gives attachment to the costoclavicular ligament. The subclavian groove gives the insertion to the subclavius muscles. The margin of the groove gives attachment to the clavipectoral fasciae. Subclavian vessels and division of trunks of the brachial plexus pass towards the axilla lying between inferior surface of clavicle and upper surface of the first rib. Subclavian muscle act as a cushion. The nutrient foramen transmits the branch of the subscapular artery.